course you're afraid of your cancer coming back. Every cancer survivor is. And this can become a huge source of stress if you let it. It can sometimes affect your day-to-day life and can lead you to worry that every pain, cough, or headache you have is cancer. While it is important to be in tune with your body and monitor your symptoms, constantly worrying about cancer recurrence isn't good for your mental or physical health. In this video, I'll be discussing how you can determine the likeliness of your cancer coming back, important signs or symptoms to watch out for, and how to better cope with the fear that your cancer may return someday. When you're first diagnosed with cancer, you're bombarded with a ton of information from your oncologist, nurses, friends and family who have had cancer or know somebody who has. And it is true that the more you know about your diagnosis, the better. But I just want to make sure that you know which information to trust, and it may not be what you expect. First and foremost, do not read cancer statistics online. Also, if your oncologist gave you a statistical value, like for example, if they told you that there's a 50% chance that your cancer will come back, or that you have a 5% chance of beating cancer, well, that's rarely ever accurate either, and I'll be telling you exactly why in just a minute. Something that can be incredibly helpful is hearing the stories and experiences of others with a similar diagnosis as yours, but the problem is that as humans, we're all very unique. We all have unique genes, cells, lifestyles, and underlying health conditions. So your cancer diagnosis and how well you respond to treatment will be completely unique as well. So please don't compare your treatment care plan, side effects, or prognosis to your aunt's, cousin's, or best friend's sister. Also, if you're the type of person who likes to research things online and you've been Googling about your diagnosis, it's important that you only trust information from either government or hospital websites or that of other healthcare professionals, but even some of those aren't always accurate. Or if you're not interested in learning much about your diagnosis, you'll probably still want to know what your prognosis is, which is the likely outcome of your cancer, how likely your treatments are to work, how long they'll extend your life, and what your overall chances are of becoming cancer-free or staying in remission. Your oncologist is the best person to give you this information because they know your medical history and things like your age, your overall health, and your lifestyle, whether or not you smoke, drink alcohol, have a healthy diet, or exercise regularly. How healthy your diet and lifestyle are have a huge impact on whether or not your cancer will come back. And it's so unfortunate because so many people don't even realize how great of an impact they have on reducing your cancer risk. I know I talk about this in all of my videos, but reducing inflammation is one of the best ways to prevent cancer or cancer recurrence. And there's no better way to reduce inflammation than by eating anti-inflammatory foods, but also by staying away from foods that cause inflammation like sugar, processed foods, white flour, and deep-fried foods, for example. If you haven't already watched my video called The Worst Foods for Cancer Survivors, I'll put a link in the description below for you, and I highly recommend watching it next. One of the most important factors that influences whether or not your cancer will return is the stage of your cancer. Cancers diagnosed at an early stage generally have a lower risk of recurrence than cancers diagnosed at a later stage. Also, the type of treatment you're able to have will significantly impact your risk as well. For example, if you were able to have surgery, chemo, and radiation therapy, you may have a greater chance of staying cancer-free than someone who is only a candidate for one or two of these treatments. And while your doctor is the best person to tell you whether or not your cancer will come back, they're not fortune tellers. They're simply giving you their educated opinion based on scientific literature and their own experience. Most doctors will avoid giving their patients statistics because they know that they're often inaccurate and people tend to get hung up on numbers. For example, if your doctor told you that you only have a 30% chance of surviving 5 years, well, that's not a great prognosis. So you can easily become overwhelmed with fear or dread, and some people won't even want to go through with treatment at that point, especially if it's making them sick. I'm going to be completely honest with you here. In the last 17 years or so that I've been working in oncology, I've sadly seen people diagnosed with what seems to be an early stage cancer have it come back within only a couple of years. However, I've seen even more people who begin cancer treatment with an unfavorable diagnosis go on to live much, much longer than their doctor predicted or anyone could have expected. This is because with the current medical technology and resources we have now, it's getting harder and harder for oncologists to accurately predict whether or not your cancer will come back or how long you have to live. Also, there are so many different factors to consider when it comes to your unique diagnosis that you should not focus on the numbers, especially statistics you find online. These percentages or values that you'll find online are most commonly used for cancer survival rates, which are based on information gathered from hundreds of thousands of people with the same type of cancer, but don't necessarily take important factors into consideration like age, underlying health conditions like diabetes or high blood pressure, or how healthy their lifestyles are. Yes, statistics are important for some things. They play a crucial role in raising awareness, guiding research, and developing strategies to improve cancer prevention, early detection, and treatment outcomes. And for these purposes, cancer statistics are considered accurate, but not for your individual prognosis. As I'm sure you're very aware, cancer can be emotionally overwhelming, and reading statistics can actually increase your anxiety, fear, or distress levels. It's important to prioritize your emotional well-being and think about whether reading these potentially inaccurate statistics about your diagnosis will be more helpful or harmful. Now, while I've been saying that it's important to try not to worry too much about your cancer coming back, it is important to pay attention to any symptoms you may be having and monitor them. So how do you know when to see your doctor if you do have suspicious symptoms? Well, a good rule of thumb is if they are persistent. If your pain, fever, or cough is taking longer to go away than usual, say a few weeks, then it's important to get it checked out, especially if you're having symptoms that are similar to those you had when you were first diagnosed with cancer. You know your body better than anyone else, so if your oncologist tells you not to worry or they dismiss your concerns, it's okay to ask for a second or third opinion. People do it all the time. Be pushy or persistent if you need to be, at least to give yourself peace of mind. As I mentioned at the beginning of this video, worrying about your cancer coming back is completely normal, but it's not healthy if it's causing you to be chronically anxious or stressed. So as promised, here are some effective strategies from other cancer survivors on how to ease your anxiety about cancer recurrence. Number 1, focus on becoming the healthiest version of yourself. Making healthy changes to your diet or lifestyle can not only decrease your risk of recurrence, it can really help to ease your mind that you are doing everything you can to beat cancer. Number 2, get moving. Not only does exercise decrease your risk of recurrence by up to 60%, it's also a natural stress reliever. When we exercise, our body releases feel-good endorphins that can naturally improve our mood and lower our levels of stress hormones like cortisol. Number 3, as much as they may cause you anxiety, be sure to attend your scheduled follow-up appointments with your healthcare team to monitor for any signs of recurrence and address any concerns you may have. Even if you're not having any symptoms, cancer recurrence can be detected at a microscopic level through diagnostic tests. Tip number 4, seek support. Connect with other cancer survivors through support groups, online forums, or counseling services. Sharing your experiences with others who have had similar journeys can be really comforting. Try to recognize when you're feeling more stressed or anxious than usual and do something to clear your mind. This looks different for everyone. It can be exercise, meditation, trying a new hobby, or simply spending time with your loved ones. Now, let's be honest. The fear of cancer recurrence may never fully disappear, so it's important to focus on what you can do to help yourself become more hopeful and resilient. Remember, you've already shown incredible strength and courage in your cancer journey, and you have the power to face whatever the future may hold. Rather than focusing on how others have done with the same diagnosis, try to focus on improving your prognosis. It's never too late to start making healthy changes. Start small. For example, swap out chips for air-popped popcorn, only eat red meat once a week, or swap out soda for flavored water. And you don't have to make all of these changes overnight. In fact, I recommend that you do them slowly so that you don't end up feeling overwhelmed. At the end of the day, it's nearly impossible to predict whether or not your cancer will come back or when. So rather than searching for answers or dwelling on numbers, start thinking of small changes you can make each day to decrease your risk of recurrence. Is it exercising more, eating more cancer-fighting foods, or trying new activities to relieve stress? Write them all down and put the list up somewhere you'll see it regularly to hold you accountable. If you found this video helpful, please let me know in the comments below, and I'll see you in the next one.